is me. Like you heard, I'm Erin Chastain. I work at Thomasville Animal Hospital. I am originally from West Virginia, although I have not lived there in a long time now, but that's the college where I went to undergrad, West Virginia University. And then I went to University of Georgia with Dr. Mason and graduated in 2007 from vet school. I did a 1-year internship just in equine medicine surgery and ambulatory, rotating right after vet school. Then I went and worked in South Central Pennsylvania, kind of in Amish country, for 6 years in an all equine practice. And then I went and worked at Horner and Nash, which is a really old, great equine hospital in the North Atlanta area, Alpharetta, Milton area. And then just about a year ago, I came to Thomasville Animal Hospital, and it has been fantastic. I love it. I get to work on a lot of these guys, which we definitely did not see in the Alpharetta area. So these are Plantation Mules. This is just a picture from that's a pregnancy, like a 28-day pregnancy in a mare, and then a castration at a client's place. So lots of variety. So I have only ever worked on horses. I mean, of course, in school we had to learn everything, but once I graduated, I've only ever worked on horses. So I've seen a lot of wounds because horses love to hurt themselves. I would guess a lot more frequently than small animals. They, of course, live outside and there are fences and they kick each other. And so it's, I would say I see a handful of wounds every week, and a lot of them need bandage. So we're going to talk about some just basic first aid, how you can kind of assess the situation with the doctor and how you can help, and then show some pictures of wounds and some bandaging, and then we'll practice. So, what does signalmen mean? Anyone?
Sex, age, breed.
Yeah, sex, age, and breed. So that's not, what would be the most important of that with a wound? Age, yeah, exactly. So sometimes an older horse might not heal as well, but really the sex and breed isn't hugely important. And then their attitude. So horses are incredibly tolerant of wounds, unless it's in a specific area, which we'll talk about. They, can have a degloved leg and they're walking around and eating. So if they're not doing that, if they're not right in eating, then that's an important thing to notice. So that's sort of something like as soon as you get out of the truck or as soon as they unload off the trailer, you kind of notice, what's their attitude? Are they stressed? Are they breathing hard? What's going on? What is a heart rate for the horse?
Had this as a test question.
28.
50 would be a little bit high, but so we usually say around 40, but certainly 28 would be normal, but usually 30 to 40 is going to be most horses. If they're like fresh off the trailer, a little stressed, they might be 44, but most of them are going to be right around the 36 to 40 range. If it's not that, what do you think? Like say it was 60.
Tachycardia?
It is tachycardia because it's an increased heart rate, but why? They're stressed, right? Something hurts, they're stressed, they're worried. Yeah, exactly. What about respirations?
8 to 15.
What was that?
8 to 15.
Yeah, 8 to 16, 8 to 15. So most horses you have to really look at them to see them breathing. They breathe really slowly. They have a really incredible cardiopulmonary capability compared to us and dogs and cats. So now respiratory rate certainly could go up with stress and pain, but also if they're like, oh, the vet's here, I'm going to breathe hard, or so they might be smelling and flaring their nostrils. So you kind of have to take all that into context. What about Tim?
Remember hands and hearts. What were some of your temps out there?
I think 106 is kind of high.
That's too high, yeah.
99 to 101?
Yeah, that's a good range. So I usually tell people less than 101. So if and most horses are really going to be in the 98, 99 range. You might have a 97 on a cool morning, and I don't worry about that. If they're pushing up close to 101, there's probably a problem. Mucous membranes. So this is important to look at in a wound because why would be some reasons their mucous membranes might change?
Anemia?
Yeah, so if they had like a really big blood loss, they might be pale. Horses can lose a lot of blood. Like I usually don't worry until you're at maybe 5 gallons. I mean, they can really lose a lot of blood and be fine. But it's always good to check that. And then alternatively, they could be dark, which could mean what? Yeah, so hypoxemia, or like there's maybe something toxic, so a wound could be into like a chest cavity or an abdomen or something like that. Pretty unusual, but it's always good to look at the gums. And horses' gums, I meant to get a picture of them in here and I didn't, are much paler than ours and dogs and cats normally. They're like a nice pale pink and they're really moist. So like sloppy saliva, and then, I didn't, but their refill time should be less than 2. And then it's really important to pay attention to the presenting complaint. So, you know, in most cases for this lecture, that's going to be the wound. You know, people are going to call you because of the wound, but you may notice other things while you're there that you want to address later on. But, you know, what is the presenting complaint? Are they lame? Are they bleeding? Are they have a gash on their side? You know, what's the presenting complaint? And then I just put this, I could email y'all this list if you were interested, but I stole this off a client seminar that I do. It's just kind of a basic first aid kit to have. And a really important thing to tell people, so one of the differences in horses and dogs and cats is that a lot of times the horses don't live at home. So if they're at a boarding facility or a barn, you know, you probably aren't going to be there when the horse gets hurt. The owner probably is not going to be there. So it's really good for them to always have which veterinarian they use and that contact information, and then the owner's contact information on the stall with the horse. So, you know, as y'all get out in the field, if anyone did equine practice, that's a really good thing to tell barn managers and owners, is make sure that we have that information with the horse. Because sometimes, like I just went to a big farm this morning, the guy working there, it was his first day, so he didn't know any of the horses. You know, if there was a wound, he probably wouldn't know who to call. So that's a good thing to have. And then some horses are insured, which can be important to have that handy. And then this is just some basic, you know, bandaging things. It's good to have a flashlight. Obviously, if you could, y'all would have a stethoscope and some type of timer to take heart rates and things like that, but an owner may not. And then just some more bandaging stuff. Towels can always be helpful. It's good for people to have an extra halter and lead rope around because those like to spring legs and walk away, and then you have nothing to hold the horse with. That's also a good thing for a doctor to have on the truck as an extra halter and lead rope. You know, sometimes you pull up to a field and the halter isn't handy, so I keep a couple of halters and lead ropes on the truck. So, all right. So this is most important. So a lot of people, especially owners, they see a wound and they freak out. They're like, it's bleeding, it's infected, whatever. But the most important thing is looking at that overall status of the horse. So I always tell people from the minute I pull on the farm, if I can see the horse when I'm pulling in, I'm looking at its status. Is it right? Is it looking at me? Is it trying to eat? Is it walking? Or is it hanging its head? Is it trembling? All of those things are really, really important in how the horse is going to do with the wound. And then the location. So what would be some important structures that we would worry about with a wound?
If there's any bone showing.
Any what?
If there's any bone showing.
I'm sorry, I cannot hear you.
I guess if it's like close to the head or something.
Yeah, so the head heals really, really well. But you could certainly be like into a sinus or something like that you might need to address with flushing. I mean, I wish I had some pictures of some of the head wounds I've seen. I mean, full on busted into the frontal sinus. They heal it beautifully. They do great. Horses heal great. What about what else? What would be one of the most common areas? The legs. And what's on the legs that we worry about?
Would be like the chestnuts or not
The chestnut.
Like a cephalic and like
Yeah,
a vein.
I mean, they could certainly lacerate a vein. They probably aren't going to bleed out, even if they lacerated a cephalic or a saphenous or anything. But you know, usually.
Oh, wait. What about nerves?
Nerves too. There's another big structure on the legs that are really important. There's multiple of them on each leg.
The bone
The bone, where do the bones meet?
Yeah, in this one.
In a joint, yes. So that actually, if we have a wound into a joint, that's a really, really big deal in the horse. Like that can be a deal breaker because those joints are, sterile environments, and a horse has to be able to walk around and weight bear and everything. So if you have a wound on a horse's leg and it does not involve a joint, you will probably be fine. And then if it does involve a joint, about 50% of the time, you'll be fine. It just requires a lot more money and a lot more intensive care if it involves a joint. And then can it be bandaged? So most legs can be bandaged. Bodies on the horse, can't really bandage the body great. You can if you have to, but you don't usually need to. Other important structures less common would be abdominal cavity or chest cavity. Definitely happens, especially if they have like a puncture up in the axilla or the armpit, can get into the chest. But they're pretty resilient. I don't often see wounds into the chest or abdomen. So what do we do next? So obviously most of the time you're going to clean. This is something you could really help your doctor as the doctor's kind of calming the owner down or talking to the owner about the plan. You can go on and get the area cleaned up. You can use a water hose, scrub, get it all cleaned up, get the hair clipped off around it, and help kind of assess what's going on. And then the overall message with wounds is horses are really, really great at healing. They really heal well. In fact, sometimes they overheal, and we call that what? Crab flesh. Yeah, exactly. So sometimes that has to be assessed. Yeah, exactly. All right, so the most common thing we do is a lower limb bandage. So from the knee or carpus down to the hoof, or the hock or tarsus down to the hoof. And usually there's going to be a wound on that cannon bone region. That's a really common area to have a wound. And so I usually do an inner bandage with a non-stick pad, and then either just a little cling wrapper to hold that in place. Or this, I've been using these a lot lately. It's a little bit heavier. It's called a Perlix, and it has antibiotics in it. Yeah, those are really nice, and they're not terribly expensive. So, and sometimes you can get two changes out of, like you can use half for the first bandage and half for the second bandage.
Is it a pad or a roll?
It's a roll. Yeah, it's just like this, but it's just like sort of heavier duty, and it's sterile.
So would you put that directly on the wound, or would you have the telfa?
I do it around the telfa. Yeah. So I just figure as the moisture comes out through, like it probably releases the antibiotics. Yeah. And then on the outer part of the wound, you're going to do some type of big padded bandage. These ready rolls are really handy. They're very absorbent, and they also can often be used more than one time. And then brown gauze will go around that on the leg, and we'll demo all this. So to sort of even out your pressure, and then your vet wrap, and then some elasticon at the top of the bandage and the bottom of the bandage to keep it in place. And then we bandage hooves a lot. The easiest way really for me or for an owner, and we can kind of demo this today, is to do, this is an Epsom salt poultice, so a lot of times you're bandaging it because they have a hoof abscess or a little puncture wound that you want to draw from. You could also use iodine. There's a lot of different things you can put on those, but this would be most common. The reason an owner is doing it would be for an abscess in the hoof. And you can put a little handful of this right in the baby diaper, and then baby diaper up around the foot, and then I usually make a duct tape patch, which I can show you on the lab, and that goes up around there, and then you put it around a few times, and they can wear that out in the field, the stall, wherever. I mean, as many ointments as you can think of, people will put on wounds. I'm a little bit of a purist when it comes to ointments. These were just things that we had in the cabinet at the office. Furosin is a little bit old school. There was a study, I think, like in the 90s that it caused cancer, but who knows how much those mice were getting of that Furosin. I grew up around horses, so I still actually really like to use Furosin. I think it's great for sweating legs, so for pulling out swelling. I also think it's really great for encouraging granulation, and it's really cheap, and everyone can find it at the Tractor Supply. So he always like, you want me to order Furosin? I was like, oh yeah, I do. And then Ascend, I'm sure y'all have used this. This is a great silver-based sulfa. or sulfa-based silver cream for wounds, just basic antimicrobial ointment. It's really soothing. It's used in like human burn victims. That's a lovely ointment, but it's more expensive.
That's the SSD we were talking about
Yeah.
yesterday.
Yeah. People love to use honey these days. That's kind of a big thing. I haven't used it a lot because it's really messy and sticky, but you might run into clients using that. It's fine. And then there's like a zillion over-the-counter wound products for horses. And then a steroid antibiotic ointment becomes important when we have a wound that starts to get overly granulated or have proud flesh. That steroid will help push back the proud flesh. I also really like, my first boss used just plain old white vinegar on wounds with proud flesh. Love it. It's not going to overcorrect. It doesn't encourage infection. And I just usually saturate like some gauze pads right on the wound, wrap around it. Easy, cheap. People love it because it's kind of like a little homeopathic type thing. So that's, I didn't have any vinegar for the picture, but I use it a lot. All right. So you walk onto the farm with your doctor, and this is the wound. So what would y'all do with this? What could you do while the doctor is calming down the client who thinks their horse is going to drop over?
Clean it.
Clean it, absolutely. What about clip it? Yep, clip it for sure. Yes.
Do you prefer cleaning first and then clipping there? I mean, what?
Yeah, I do usually at least start cleaning because this one was actually pretty fresh and clean. Like they saw this happen. This horse came in. Can anyone guess how this happened?
On the beds.
Yeah, on a gate latch. Yeah, so we're coming in, got pushed through the gate by another horse and just open. Can y'all tell where this is? So this is the withers in the back. So the head's up here, the tail's back here. That's another really important thing, actually. People always send you pictures of wounds, which is great. I love that. But they literally want to take the picture, like, right here. And you can't tell where it is, how big it is, anything, because there's no perspective. So I always tell people to, if they want to send me a close picture, whatever, that's fine. But we can all zoom, right? So step back away from the horse so that kind of the whole leg or the whole half the horse is in the picture so you can get some perspective. So if y'all are on the phone with a client and they're like, well, let me send you a picture, you can say, like, please don't we can zoom in. It's really just more important we see where it is and how big it is. So this would be a wound that is really important to assess the status of the horse because this is over the chest cavity. So this horse was fine. It was eating fine, heart rate normal, breathing fine. If you didn't know this wound, if you were on the other side of the horse, you wouldn't even know it had a wound. So that's exactly what we did is clipped and cleaned this up, and I actually was able to close this. It didn't hold for very long, but it did get closed enough to kind of granulate in some, and this horse did great. I don't have an after picture because this was probably 10 years ago, but this horse did great. And no bandaging, right? This is actually my personal horse. So what would we worry about with this wound? So this is a perfect one that you would need. Someone might want to send you a picture that's like this big, and you would have no idea where it is. But what's important about the location of this wound?
It's on the leg.
It's on a leg, but where on the leg? It's
Close.
very close. It's on top of the hock, right? So that is actually the exact location where we inject the tarsometatarsal joint. So that is directly over the tarsometatarsal joint. But he was sound. The farm owner hadn't even noticed it. I saw it when I came, and his whole stocking was covered in blood. And he would, like I said, he was sound. So if it had been into the joint, he would have been really lame. So just knowing that he was sound was a good thing. And then obviously here I've already kind of clipped it and cleaned it up some, but it was pretty well covered with hair actually. You can imagine if the hair was hanging down from that upper margin, you wouldn't be able to see the extent of that wound. So this was after just maybe a week or so. So what's that sort of?
Granulation.
Yeah, that's really nice, pretty healthy granulation tissue. And then what about that white rim? What does that tell me?
The skin's growing over it.
Yeah, it's contracting down, right?
Mm-hmm.
So this did really well. I think at this stage I've started putting maybe just a little bit of steroid ointment because we have that little bubble of proud flesh there. What do you think I bandaged this with, as far as like materials? Thoughts?
Once they have granulation tissue, what kind of primary layer do you want?
You can leave it open when there's granulation tissue.
That's actually a really good point. I could have left this open, definitely. I mean, he is fully filled in there. I didn't, just because I had the easy ability to put a little bandage on it. So he got mostly this little bit of steroid ointment on there. This is after it reached this stage. This little bit of steroid ointment, one of those thicker Curlix wraps, and then just some elastic-on sticky tape over it. So if we go back, by that point, I was really just putting a bandage on it that went about this big. Now, the first day that I saw it, I put that inner layer and then the full-in bandage on it. Just he had some swelling and just to put a little pressure on it and everything. And I think I probably just put like some basic antibiotic ointment on there initially. But he did fine. He was completely sound. This is a nasty one.
Oh, that's probably.
So this horse, I don't have any from the first day I saw it on the farm. This was the second day that I saw it on the farm, and it ended up coming to the office, and it's already been cleaned at this point. So this horse is a youngish, like 5-ish, I think she is, Mustang that had her legs handled very little up to this point. So to deal with her on the farm was really difficult. Even getting her sedated could sometimes be difficult. So we tried, I think I saw it maybe on like a Thursday or something, and I tried for them just kind of cleaning it with a hose and putting some ointment on it for a few days through the weekend, and then came back to recheck it and it looked like this. So what we were doing was not working. So she came into the office, and so this is a hind leg. I know, again, I'm not really following my rules very well of showing you enough of the horse, but at least you can see the hocks there. What do you think I did with this?
Cut the flesh out.
Yeah, cut the flesh out. Do you think I did that with her standing up? I laid her booty down. So she's in the surgery. This is actually the surgery table in the floor here. I didn't put her up on the table or anything. I just knocked her down with like a castration dose. I didn't put her on prolonged anesthesia, and cut all of this nasty tissue out. And then I also cut this big piece of skin off that had flipped out. That's not going to go back up. That skin's done. So this was the very next day. Doesn't that look so much better already? I mean, it's still huge, but it's flat. The skin margins are flat. And this is her in the stocks. In the stocks with some sedation, I was able to bandage her very carefully. So she has kind of a light bandage underneath of this standing bandage right over top the wound with those non-stick pads, and just some of that SSD. And then I actually used some elastic on her, because in this location, they slip down really easily, because every time that hock bends, it pushes that bandage down. So I did some elastic on over that underneath wrap, and then a standing wrap over top of it to support and keep that bandage up. So this is at 2 weeks. These are the owners sending me these pictures. So she went home. She stayed for maybe 4 or 5 days. We did a couple bandage changes, got her used to having the leg handled. They're very capable owners. So this was at about 2 weeks. This is about 3 weeks. This is a little bit just the angle of the picture, why it looks so much bigger in this shot, and I think it's been cleaned more on this one versus this one. But you can still see it's flat, and it has this nice margin contracting down. And they were bandaging it every day. So this is about a month out. You can see still it's contracting down. Even though it's kind of like scabby and gnarly looking, that's all closed down, healthy tissue. And then this is now. So it's made a huge amount of progress. This wound initially happened, I think it was like in November. So it's done pretty well over a few months of care. And they got to a point not too long after this where we stopped bandaging and just cleaned it each day and put the steroid ointment on it. And it came down to this. So this one, I didn't see this one the very first visit, so I don't have a first visit picture. This is also a hind leg. This is on a yearling thoroughbred filly, so she was a race filly. So the owner was unable to do her bandage changes because she was real light with her hind end unless she was sedated and had some drugs on board. So what do we worry about? What structure is this?
That is like,
What is it? What's like the lay name for it? Everyone calls it what? Fetlock? You heard that term, fetlock?
Yeah, they learned it in the nest.
Okay. So some people call it the ankle. That's also just kind of a lay term, obviously, to call it the ankle. But if an owner says to me, oh, there's a wound on the ankle, I always specify, like, is that the ankle by the foot or is that the bigger ankle? Because a lot of times owners don't know and they'll call like the hock the ankle. Sometimes they're calling the carpus the ankle. You just never know for sure. Or vice versa, though, they may know the term fetlock, but they don't actually know that this is the fetlock, so it'll actually be up on the hock or the carpus or something. So that's where pictures come in handy, or just seeing it yourself. Yeah, so it's over the fetlock joint. So again, luckily this filly was sound, so we didn't worry about it being into the joint. If they have a wound into the joint, most of the time they're going to be toe touching lame, like really super lame. But she needed to be a race filly and sell at a big sale in Kentucky, so we wanted to make sure that this got healed nicely. And you can see that this piece of skin had kind of shrunk up there. So I bandaged this filly twice a week for like maybe 2-3 months, a long time. So here's a nice progression of it. So this was probably maybe 3 or so weeks after that first picture, and then again a little bit later, and then you can see it got really nice and tiny. And she was again getting similar to what I said with my horse, where she had a light bandage, that light inner bandage over this, and then a standing wrap over top of it. And then as we got smaller and flatter, we went to just a little light bandage with elasticon and gauze and a non-stick pad. So this is one, you can see there's the hind leg, so this is a front leg, so what joint is that? The knee, yeah, we call it the knee. It's actually the carpus, but we call it the knee. Analogous to our wrist, but way higher up in the horse. So this is one that Dr. Cooley actually just saw pretty recently. This is like a 2 or 3 year old horse that went to the trainer and tried to jump out of like a round pen or something and tore up his carpus. I think this one actually was pretty, I didn't see it on presentation, but I think it was pretty lame. But got lucky and actually was not in the joint. But this thing hanging down right here, any idea what that is? What was that? I can't hear y'all.
so she said the patella.
It's not patella, so patella's in the hock, it's in the back leg. I can't see. Yeah, it's not the greatest picture to illustrate it, but so that's the extensor tendon of the knee, so the common digital extensor tendon there. And if this was on the back of the leg and it was a flexor tendon, that would probably be a deal breaker into the road for that colt. But the extensor tendons are really resilient because they actually can learn to just place their leg, flip the toe up and place the leg, and do just fine even without repairing that tendon. Now, like I said, the flexor tendon's on the back of the leg, that's a no-go. If you had a transected flexor tendon, they're going over the bridge for sure. So I think Dr. Cooley actually did try to repair this, and of course it fell apart. That extensor tendon fell apart because there's just too much tension on it, but it was worth a try. And so he closed it up. So this was, I think, maybe a couple of days later. So he was able to close it up. You can see that nice suture line there. It got sound pretty quickly once it was closed up and had some pressure on it. The swelling was down. Obviously really good antibiotics. And then this was it just last week. So the sutures are out and it's all kind of healed up and doing well. And that colt should have no limitations. This was, now I just have some G-Wiz ones that I didn't have befores and afters. I just have like some intermediate pictures. But so this was another horse that went. Oops. This is another horse that went through a fence, and one point there was a big flap right here and this stretched up that I sort of tried to save and it didn't work, so I had to cut it off. And this owner also was a very diligent bandager, so she did a wonderful job bandaging this horse. It actually had some wounds on the hind limbs too that have healed by this point, but that healed up completely. And this was probably, gosh, a month or two in. So it was a nasty, really nasty wound.
And it didn't go into the joint. It looks so
Didn't
deep
go
in
into the
picture.
joint. Yeah, it's pretty amazing. They can, it was just kind of the skin was filleted down, and it was just in that fleshy tissue. I know, it's crazy. Sometimes you'll have a big, ugly wound like this and it's not in the joint, and then you'll have a tiny little puncture, and it goes deeper and it's in that joint, and then you have a bigger problem. So I just put these in because we do bandage feet and more distal or lower limbs as well. This is, does anyone know what this is? It's not a wound. It's not an abscess. We see a lot of these in this area, like crazy amounts. A summer sore, yeah, that's a summer sore. So,
Good job.
Yeah.
Who said that? Who said that? Courtney?
I said it too.
Good job.
yep, that's a summer sore. So, sometimes they just get them spontaneously. Sometimes they have like a little scratch or a wound that then becomes a summer sore. But they are a huge pain and really require really diligent bandaging and care, especially on a lower leg like this. So typically we mix up a little something to put on there that has some ivermectin in it, some steroids, some DMSO, some antibiotic, kind of mix it all up, and then the owner just has to stay really diligent with bandaging it and getting some good pressure on it to keep it from bulging out. So I think this was maybe 10 days after I initially saw it. You can see it's starting to have, it's really nice and flat, and it's starting to have that really pretty rim around it. So these bandages do usually have to be changed like every day or every other day, just because they get dirty. No matter what you do, they get dirty. And you do want to make sure that your bandaging material comes down under the heel, or else it'll just ride right up again. A face bandage, so this is a horse I nucleated. We do those standing on the farm, so that's a really neat thing to be able to offer. And of course I don't have a picture of him in his head bandage, but after we do an enucleation, I usually place a head bandage, which is just a big wad of gauze. Sometimes I use this in non-stick, but not always, over top of the surgery site to put some pressure on it, because there's a big clot inside that empty socket now. And then use the elasticon to figure eight around the head, of course leaving the good eye uncovered, and then coming kind of behind the ears, so it just looks like they have a mask on that's covering that one side. So this is another type of foot bandage. So this horse, this is not uncommon, had chronic hoof abscesses that then got him a little osteomyelitis here into the coffin bone. So this view, do y'all know how this view is taken? Have y'all done radiology? Okay. So this view is taken of the top of the foot. There's two ways you can do it. You can either stand them on what we call the tunnel, which is the box with a slide in it. You can stand them on it and put the plate in the box and shoot down at like a 60-degree angle. Or you can put them in this little block called a Redden block, where they stand kind of on their toe and the plate's behind the leg, and then you shoot straight at it. Either way is fine. To get those, it's called the solar margin view, P3 solar margin. So this is that margin there. So this side is normal, so it's normal to have these invaginations. It's not normal to have that real lacy appearance right there. So this horse had a chronic hoof abscess that then seeded the bone. And so this was here, right after I got here last year. We debrided down through the sole and to the bone. This is a while after we had done the surgery, but cut the sole away and debrided down and used a curette. This is done standing. It was a front leg. Curette to curette away all that soft infected bone, and then they get what's called a hospital plate, which I also did not have a picture of, but they would have a regular horseshoe on, and then there's a metal plate that bolts over top the bottom of the hoof. It bolts to the shoe and covers that area, and you can pack it with Silvadine or betadine or whatever it needs at that stage. And then over top that hospital plate, you usually put like some duct tape, some better wrap than duct tape and that type of thing. You want to have a really good farrier that's used to doing these. You don't want to just have any farrier. In our area, this is Dargan Waters. He's a grumpy bear, but he is an excellent farrier. So, he does a beautiful hospital plate. But that's something that easily, y'all, if you worked in an equine clinic or were on the farm with a doctor, and easily y'all can pop those bolts out, change that bandage for the doctor. And this horse is finally sound. He had a really sort of a long road. Most of the time, these do really great within like 1 to 2 months. This horse took the longer route. He was more like 4 or 5 months. But he is sound now, and that's all grown out. This is my dog. When he was a puppy, and he chewed that little heart in the carpet to tell us how much he loved us.
You had to show his affection.
Oh boy, yeah. We replaced that carpet, but I just loved it. I was like, okay, how mad can you be when it's a shaped little heart? Oh boy. Y'all have questions? Do some bandaging. Talk about their barrel race this weekend, or that they're going to the Orthodox in Ocala, or when you know what they're talking about, that gives you kind of like a street cred with the owners. So this is gonna really have to bandaging, I promise. But so I encourage you, if you do decide to do some equine work, to try and get sort of a little bit involved on the side, or like read some horse magazines or anything like that that you can do to kind of gain that just basic knowledge about horses and all the disciplines and stuff. And the reason I say that is because there is this well-ingrained belief that horses have to be wrapped with a roll on the outside and going back toward the tail. So on these legs, it would be like this, and on those legs, it would be like that. That is actually not true. That is actually a myth. As long as you apply even pressure around the entire leg, it doesn't matter how you bandage it, but I can promise you, if you show up at that farm and you bandage it like this, they're gonna be like, that person didn't bandage my horse's leg wrong, load the tendon, and you are gonna have zero credibility with that client or owner. So that's why you'll notice that people pretty much always do it in this direction. So, if we were we'll just pretend this horse has a nice little wound there on his hand.
You are welcome to take that home again if you like.
You get used to it for a second and it's like, oh, that would be nice. So I usually put my ointment onto the pad. If you try and smear it on the leg, then it's like dripping down. If you put it onto the pad, it accomplishes 2 things. It stays on the pad, and it also, usually if they're gonna react, so maybe the horse is sedated, you've already cleaned it and clipped it and stuff, but they may still react when you put that on there. So what you wanna do, first of all, is you wanna be standing, you don't wanna be like back here underneath the horse or like directly in front of it or anything, because on the front leg, they're gonna do this kind of thing, right? So here is a really safe place to be, or as safe as you can be. So I usually and I hold my hand there. That way, if they're gonna react, you don't have, it's gonna land ointment down every time. So if you just put it there and just hold it there for a second and let them have their little reaction, and then they'll be still, and then you can kind of come down and kneel or whatever, not kneel, but crouch down. So you have your roll on the outside, you're headed back toward the tail, and you actually put, a decent amount of pressure. Not as tight as you can pull it, but enough that it's gonna stay in place. And you wanna cover that whole non-stick pad. And then I usually just kind of tuck my edge in so that it stays. And then you'll have kind of a cotton wrap or something like that to put on. So again, you want to have roll on the outside, rolling back around the leg. Does that make sense to everybody? Just want to Make sure it's, flat underneath of there, like rolling on in a good direction. And this padding allows you to put pressure on without really cutting off the blood supply. So that's a big difference between small animals and horses, is like you can really put some tension. On a leg bandage, you can really put some pressure on it with this amount of padding. So then you're going to take your brown gauze, same thing, make sure your roll's right. And I usually start about at the top, maybe a third to a quarter of the way down. And this is the one where you're really going to start to pull it. And you're really going to put, some pressure on there. It's going to hold down swelling and hold everything in place. And you want to kind of come down around the fetlock. This is not a real horse, it doesn't have a super defined fetlock, but you can kind of come down around the fetlock and come back up again. And you're just pulling it, keeping it flat and tight. So that you have just maybe about an inch or so of padding sticking out the bottom and the top. Sometimes I'll cut this if it's like this is a really short canopin, but depending on the size of the horse, you can kind of keep going up and down. Get some good tension on there. That sort of sticks to itself. And then you're going to do the same thing with your vet wrap. I won't waste all the time doing it myself. And bandaging just takes practice to make it like look pretty and be good. But then you would do the same thing with your vet wrap. And you're going to pull your vet wrap tight enough that it doesn't have like bubbles in it. There are little dimples. It's going to be pulled tight the whole and evenly on both sides of the leg. And then you would take your elasticon and put it like right here. So it would be kind of in this. Now this is one that I don't worry about what direction I'm going because you're not putting any tension on it. So it's going to be about halfway on the skin and halfway on the bandage. And you don't pull this one super tight. I usually sort of pull it out and then release it and then lay it on the skin. Now if you want to put it down, like say you have a wound down here that you really want to get some good pressure on, then you could really pull that tight. Then you can go down the whole leg. But typically we would just put it at the top and then at the bottom, and you're going to kind of go onto the hoof and come around the fetlock. And that just keeps dirt and stuff from getting up under the bandage and keeps it from slipping. So this is probably the most expensive material on the leg. So you want to keep those kinds of things in mind. All right. Probably can't save this, but I guess I can wind it.
I'll roll it back up for you.
Okay, perfect. I didn't really think about that one, I put the whole thing on there. And then I'll show you real quick how I do a duct tape bandage. And then y'all can have at it. Maybe we could do 4 people and I'll give y'all pointers or whatever. Take your rolls. And it's nice if you can have, like a little, if you're in a barn, so usually the floor is dirty, right? So you're not gonna put your stuff on the floor. So you have, I have a couple totes, so I'll put everything in and then I have my tote right there. Or sometimes there's like a little stool or mounting block or something like that where you can put everything. Because most of the time, I don't have a tech with me most of the time. So, especially for wounds. But sometimes
that one.
yeah. I have anytime we're in the office, we have a technician. So there's always someone, unless it's after hours. And then I do have someone on the road with me on Wednesdays, which is really nice. And then kind of an as-needed basis other than that. We could probably even like cut this so that more than one person could do at a time.
You think what in half?
Yeah, I think probably half would be good.
I've got some more. They don't kill it
Yeah,
yet.
and I think that we bought some photographs too.
Oh yeah, that's a good one. So sometimes I will too, if it's not that bad of a wound, like I'll just put a little light bandage around it, like what I call a Band-Aid, with like this and the Telfa and some elasticon to hold it in place, and then I'll have the owner put a washable standing bandage over top of it. So that's totally fine to do too. So if I'm doing a hoof bandage, I'll put it on the floor because it's clean. I usually do make this whistle work before I start doing the diaper and everything. So I usually put like about 4 strips, depending on the size of the foot. About 4 strips down. About 4 strips across. So it's going to look like a plus sign. This is, I'm doing this one, not using as much as I might, because again, you always want to have cost in your mind. So then you have your pad. So that would go, the horse's foot would go right there, and then this just all folds up around it, like a nice little pad, like that. And then you take your roll and go around it a bunch of times. So that's really handy though. And then the diaper would have been, you know, again, you can put your, whatever you want to put in the diaper, and then put that up around the foot. So, all right. Y'all want to give some stuff a try? Yep. Like y'all would obviously not be on your knees there, and then what you don't get behind the leg.
You gotta have good thigh muscles.
Quads, steel quads. Yep. So flip this over. There you go. See how your roll's on the back now and going back around the leg? Yep, you're good with yours.
Okay.
But see how you're rolling forward? So again, it doesn't make a clinical difference, but it's going to be that owner is going to be like, well, she rolled that wrong. Let's see. That way. Yeah, wait. This way. Yeah. Kind of very tricky. I'll roll it. Yeah, there you go. Okay.
I'll see, some people do split cups,
Mm-hmm.
and they roll it.
The wrong way. Yep.
I mean, I don't do them, so
Yep.
I don't know the science behind it. Or if you said there's not, so.
Yeah,
it doesn't
yeah.
matter.
So again, so you're going forward with that. See how when you're on the outside of the leg, you're forward.
Okay.
So it would be, if you want to, you can just finish it, and then
Okay.
I'll show you with this.
Okay.
So if you roll that up into a roll first, it'll be easier to handle. Yeah, if you roll that up if you roll that up into a roll first, it'll be easier for you to handle. Yep, just tuck it. Yep. Perfect. There you
This
go.
one?
Yep,
Okay.
exactly. And if you come lower that down a little bit, so that you want it to kind of come below the step block.
Okay.
That just gives you that point of wrapping that'll help hold it in place.
Okay.
So don't flip it over.
Okay.
Yep, there you go. Yep, exactly. And same with you. So this is the knee. So this bends, right? So you want to kind of be down low. Yep, exactly. And then same here on this hind leg. This is going to be bending and moving a lot, so you want to come down a little bit further. Yep, there you go. And it's just something like over time. You can use that over time, your hands learn how to hold
Thank you.
the pressure and everything. Yep, good. Yep, and make sure you're pulling as tight on the inside as you do on the outside. There you go. Correct. Yep, exactly.
Like this?
Yep, exactly. Right about there is right. You want to start about a quarter of the way down the leg. Yep. Yep, perfect. And you can go way tighter, way tighter. It should smash in that bandage.
Do I know if it maybe more? Go up here some?
Nope, you want to leave here about an inch at the top and an inch at the bottom, so that's really good. Yep, you're right. And it just takes practice with those hands. So the biggest thing I would say here is you don't want to go past your what. You always want to have a little cotton hanging out the bottom.
Okay.
Yep. And you can probably go a little tighter.
Is that better?
That is not too tight. See, you want to pull it like almost to where it's gonna, yeah, you really want to go tight like that. It will, and you want that pressure on the leg. You want, they don't have all that sub-Q like a dog or cat has. It's literally just like bone and skin and wound. So you want to go down till there's about an inch hanging out the bottom. Lovely.
All right, well, thanks. I need, I'm getting it. Okay.
So see where my part is and see where your part is, so it needs to be tighter.
You do this at the bottom also.
You do, yep.
Thank you.
Yep, exactly. Great. There you go. There you go. And it's just a like learning with your, so this sticks to itself. So once you've got it on there, you don't have to hold it in place anymore. So you can just use the leg as like your leverage. Good, that's beautiful. That looks like I did it. That's perfect. Excellent.
She wants to go to work.
Oh, there you go. Good. Good, that's much better. See the difference? Good, that's much better. You can just run it out, just come back up again. So that pressure helps prevent the proud flash. Sorry.
No, you're good. I didn't want to put you off.
So the biggest thing I would say for you, you do, yeah, but that's okay because this rack is a little bit long for this leg. But what I would do next time is just air with more out the bottom and not so much at the top. But your tension is really good. Yep, so see how she went kind of like about halfway on the hoof and halfway on the bandage? You're going to cover up all the white part. Yep. Yeah, with the elastic on, it's not as big of a deal because you're not pulling tight on it really. But there you go, yep. Yep, perfect. And then so when you come around to this time, you want to come down lower like that. So, because you have to remember this horse isn't in a clean house. It's going to be in a stall. No matter how clean the stall is, there's still going to be poop and pee and stuff. So that helps all that stuff from getting pushed up underneath the bandage.
Excellent. So like if I have this, can I just go around twice?
You could, yeah, you could, yep. You just want to start up on the skin because it's going to hold it up and heat. Yep, exactly. Perfect, good. All right. And my favorite colors are purple and green. Yeah. Conveniently. Do y'all want to try anything else, or more people try legs, or? Sure. I think the biggest thing is to feel that amount of tension that you want to have on there.
Can you show us one on the face?
I can, yep. We'll take the halter off. So we'll pretend that we'll pretend this eye's enucleated, so that way you can see how to leave this eye out. Does that make sense? So usually when I bandage a face, I have someone else, like I'm not going to do the enucleation by myself, so usually there's a technician or something there. And so one of us stands on one side and the other one stands on the other side, and we hand the bandage off to each other. But I would start, so if I had enucleated this eye, I would probably start like right here. And you could also bandage for like a sinus wound. I usually don't really. Usually like even if I have a big wound on the sinus, clean flush, and then most of the time you can get the skin over it, and I just staple the skin closed and it heals. They're amazing at pulling their heads. So you can't see the other side, but like if it was this side, I would probably start like that. Around. And there's no real like magic cannula to it. He's not going to headbutt me, so I don't have to worry about being. So you would not stand right here and bandage a horse's face. You'd be, guaranteed to get headbutted. So, and then you just kind of keep going around and leave this. Make sure you're leaving this one out. And again, you kind of pull it out and then release the tension and sort of just lay it on the face because this stuff's really sticky. So then this one I might come. I would maybe go behind on this one. Yeah, he's really tall. He'd be sedated and his head would be hanging down. Yeah. So that way the ears help hold it on. And then you just kind of keep going around and you look at where you feel like it needs more. So you might go around again that way again. And then you can always at the end, like I'll take the scissors and just cut out to just make 100% sure that that eye isn't going to be hit by the bandage. So.
You wait there.
Yeah. So y'all get the gist, and then you can see over on this side of them. So probably actually what I would have done with that one is rolled that. Let me just finish that actually. Back over here, buddy. So I would have come across here, come down this way because I have a gap over here that y'all can't see. And sometimes this takes 2 rolls just depending on the size of the horse's head. And then you also may end up having to trim it right here, like trim a V so that they don't have binding pressure on their throat. But if y'all want to see his the other side of his face, you can see how well covered that is. So see? And then when you take these off, I usually just cut right through there and just peel it off. I cut behind the ear too. They're not going to love that pulling over their ear. And they usually react, but you just kind of grab it and hold it, and then they pull their head and it pulls bandage off.
And they get better for you.
Yes, exactly. All right.
Great.
Oh, and when I take one off, I usually actually use a blade because it's a lot easier than hacking through with bandage scissors. So you just kind of peel the elasticon back. If you don't feel comfortable using the blade that goes to the skin, you can cut this part with scissors, and then I just with the blade, and then it just peels open. So roll.
Oh, yeah. Wait a minute with your rolling.
Hold on. Pause on the right hind here. So take that back off. Roll that back up. Perfect. So roll on the outside, and then rolling back. Yep, just like that, exactly. And then come down a little lower. So the biggest thing I see is people are wanting to have your bandage really high. Yep, so you want it to come down underneath that ankle. It should hit sort of mid-pasture.
So about right here.
Well, that part doesn't. That's going to go wherever your wound is, but then your big pad is going to go below the fetlock. Yep. Good. Yep, you pull that tighter, pull out tighter. Yep, there you go. You really want to indent that. You should be able to see like the shape of the leg through that round. If that makes sense. Yep, and it's obviously challenging to use a roll that's already been unrolled, but you would always want to just make sure that it's nice and flat and straight and a lot tighter. So no dimples.
So this way rolling right?
Yep. Oh wait, no, you're backwards. I think you want to go for the tail. You do, but on the outside of the leg. This one? Correct. Yeah. Sure you don't hook your top up. Lovely. This is lovely, but if this was a real horse, you could die if it kicked you. So just think a little bit about body positioning. There you go. That's better. And you will be judged on your bandaging. Your owners will judge you, trainers will judge you, farm owners will, they will judge you on what that bandage looks like.
That's what I've told them about
Yes.
IV catheters
Yes.
and any
Yes.
Robert Jones. Or
Yes, exactly. So always thinking about it being like very tidy and even, like even I can't stress enough, like every little roll should be the same. As I go, yeah, there you go, good. Good, excellent. Good, good, good. Good, yep. Yep. So on a real horse, you would probably have more elastic on and you would just kind of come down and make that a little bit more even, but that's for our purposes, that's totally fine. Good. Good. So your tension is good, but again, it's a little tricky with these re-rolled things, but you want to try and not have any of these like lines.
Yes, ma'am.
So I know that's tricky.
Yeah.
It might be easier if you come like here.
Yep.
Might give you a little bit more space for your arms and stuff. Yeah, good. Excellent.
Yeah, it's just tough.
Love it.
Do you want to leave some?
Yep, you're gonna leave some, exactly, perfect. I feel like we have to do a lot more in front of the client than smiling with us. I mean, most of the time the client's there.
Yeah.
Like 99% of the time the client's standing right there. So, you go a little slower on this one. Really cool. You don't have to do the whole thing. Yeah, there you go. Yep, exactly. Exactly. And then pull it tight when you come around this way too. Excellent. Good, perfect. That's beautiful.
I couldn't get the bottom on.
Yeah, that's okay because we have kind of a limited amount of elastic on. This is good. You definitely tidied it up like I was watching you, so you sort of tidied it up after I started talking about it being tidy. So just focusing on I think your tension's pretty good and your placement's good, but just focusing on keeping it really nice and even and no bubbles and stuff. And that just takes practice, like it's just hand memory.